And now on Nights with Steve Price from the 50-Up Club, Christopher Zinn.
Very timely to talk to Christopher any week, but during an election campaign even more so. He joins us on the line. Good evening.
Yeah, there's plenty of food for thought in this election campaign, and just wonder what we should be eating, what we shouldn't, though.
I think that it's going to get closer to the election date too. Many of these pivotal issues will become much more important. We're talking peripheral stuff at the moment, but when we get down to, and we're talking 50 plus people here, the superannuation thing will always be a problem for the coalition. But there's other issues such as health, which I think that's going to be a stark difference between the two parties by the look of it. And you've seen some polling on that.
Yeah, well, I mean, very interesting polling in terms of, it was in the Australian earlier this week, in terms of who's better capable in terms of key areas. And perhaps not surprisingly, Bill Shorten's come up as the most capable in terms of health, whereas, the Prime Minister is ranked more in terms of the economy. So it does seem this great healthcare debate that goes on. It all has to be paid for, of course, and that's what Mr Turnbull keeps reminding both the Labor Party and ourselves. But, of course, the promises of cuts to this, that, cuts to the cost of this, that, and the other is, of course, perhaps more politically palatable.
One of the things that was a big election issue last time around was the idea of a GP copayment. Tony Abbott introduced it, and they backed off in the end because the GP lobby was very strong, and there was a fair amount of chatter out there in the community that they couldn't afford to pay $5 or $7 for a visit to the GP on top of their bulk billing discount. I mean, I think that's wrong that they dropped that, and that we do have to start to introduce some sort of co-payment recognition that you don't get everything for free. But it would appear Labor's position on this is to continue to allow the doctors to charge more, but for it to be bulk billed, and people still are going to be able to get that free health care. The Coalition, on the other hand, has frozen those Medicare rebates for doctors. What do you think of that?
Yeah, well, look, exactly. I mean, we're told that we have to have price signals in so many other areas to determine what we shop and buy, and the Reserve Bank has done something about credit cards today, for example. That's all about price signals. But in terms of medicine, that's a big no-no, and, does scare patients, the amount. But look, I mean, I remember last time they were talking about the co-payment being the equivalent of a cup of coffee, and not for concessional people. That was for general patients. So, look, I'm sure many people could afford that. They certainly can afford lots of cups of coffee, and I suppose it's how much you value your healthcare and the affordability of the system. But rightly or wrongly, there just seems to be a line that getting people to contribute a co-payment, which I think does remind people that there is a real cost to that, and it's not just comes out of an endless bucket of money that funds doctors and pathology and everything else, is probably quite worthwhile. But even when those are modest amounts, I'm afraid there is a big political backlash.
Labor always does better on health. I mean, the Coalition will argue that they're the better economic managers. We have this issue also of whether there might be, Labor's running a scare campaign about Medicare being privatised. Well, no one in the Coalition has suggested they are about to do that. Medibank Private it has been largely now privatised. That's what they're talking about. No one's suggesting that Medicare is somehow going to end up in the hands of private providers, are they?
No, not realistically, at least. I haven't seen any plans. I mean, it was a big scare when, Medibank Private was going to be privatised or put into, and people could buy shares. And that seems to have happened. I haven't heard any reports. Suddenly they're knocking back a lot of claims, or somehow they become more hard-hearted or whatever. Yeah, look, it is that, Medicare's a fantastically strong brand and people believe a lot in it. But I suppose the argument is about sustainability. How long can you keep something going when all the time the costs, and we know that just from our private health insurance, the rate of medical inflation is way above that of ordinary inflation. How do you keep paying for that? Ultimately, we do pay a Medicare levy. That has been played with and gone up over time. So, how much can you keep charging? And ultimately, something has to change. And look, I do tend to agree. A co-payment for those who can afford it surely does help us value the system a bit better.
I think what the Coalition's got to do, Christopher, if they are going to actually prevail and win this election, what they've got to do is they've now got to start talking about if you manage the economy properly, the economy will grow, and if the economy grows, the share market will grow, the job rate will go up, and if the share market grows, then the retirees that you and I largely are talking about, a lot of them self-funded retirees with, modest to medium-sized superannuation accounts that they're going to retire on and they're going to rely on to retire on. Those superannuation packages this year are very low returns or negative because the share market's largely had a rough 8 or 9 months, and you can't earn a living off interest because interest rates are at record lows. So if the coalition wants the older voters to vote for them, they have to start convincing people that if Labor gets back in, the economy won't be as healthy and their superannuation accounts will continue to stagnate.
The prognosis is not good for super. As you've said, the rate of return is going down, the fees stay the same. There's a great deal of uncertainty through what we've talked about in the past few weeks after the budget and changes that they've made. Yeah, it is it does seem to come down with that. As you've said, that clearly the coalition claim that they haven't, and the people seem to believe that in terms of polling, that when it comes to the economy, they're more reliable. But I suppose it depends on if everyone feels that they benefit from the economy. We've just been through, 20 years of record growth, and compared to the rest of the world, we should be laughing. But there still seems to be a significant number of people who at least feel that they've been left out of it and haven't got a fair cut of the cake. And, that certainly that is something that perhaps Labor wants to appeal to, that sort of section of the electorate.
I also haven't heard anybody in the media, myself included, yet ask the main players, what is your policy on the rate of the age pension?
Yeah, well, look, the pension went through a lot of changes in terms of the taper rate and the eligibility in terms of the budget last time. Now that all kicks in at the end of this year, and it's going to be a bit of a shock to people. Some financial planners I've spoken to saying they've got people coming in who really don't realise the impact on them could be quite severe. But there's been no talk of the pension, although, as you'd probably have seen too, in terms of some of the think tanks talking about the fact that the family home should be part of the eligibility test for the pension, more and more voices seem to be raising that formerly taboo issue. And I've no doubt that not in this election, perhaps, but down the track, we're going to have to see a lot more argument about that.
I'll make one tip here that in the next, I think we've got 5.5 weeks to go, something like that, I think, 5.5 or 6.5 weeks. There will be one or two big issues that are going to attract attention of people in the age bracket we're talking of, the 50-plus people who are in the 50-up club, and we're going to have to then, I think, wind up the rhetoric a bit. I think it's still to come. I'm not sure we're at that point yet.
I'm sure too, because they are such a vital part. They have a lot of clout in various seats. There's a lot of them. They are active. They do tend to understand what's going on. So, as I said, we said the 50-up club. They're a very influential demographic, and they should be listened to. So let's hope we can translate that into some positive political action as well.
What's the 50-up club web address again?
50upclub.com.au, and we've actually got a healthcare survey on this week. You might like to look, asking you about healthcare costs and how they influence you in terms of your vote and decisions. So we'll be able to report back in a week or two in terms of actually how people are feeling the pain, and if there was a PBS copayment, even 80 cents for someone on a concession, if that would be a make or break for them.
Good stuff. I would urge people to jump online and have a look at that poll. Thank you very much, Christopher. Talk to you next week.
Thanks, Steve.